Visiting a gynecologist can sometimes feel intimidating, but being prepared can make a world of difference. Whether it's your first time or a routine visit, there are some key things that you can do to ensure a smooth and productive appointment. As doctors, we only have 20 minutes maximum to find out what your problem is, examine you, and also do an examination. Sometimes we find that as we're doing these consultations, we're spending the whole time trying to find out what the problem is. So by having a set of questions and things already prepared will allow you to maximize the time that you spend with the doctor.
Absolutely. So you have to go into it thinking that preparation is key so that you can get the most amount of time from the doctor explaining all your management options so that you can go home equipped with the right things to do. Okay, so we've put together some questions that you would want to come into the appointment having so that when you go out of it, you feel satisfied. So the type of things that you would want to know include: what are the potential causes of my symptoms? What tests does the doctor recommend for me to have? What are my management options? And what lifestyle changes can I make to improve my symptoms?
It's also really important to come prepared with information about your own history.
And so here are some of the questions that they would likely ask you during a consultation. So one of the first questions we always really ask is, what are your periods like? So how long are they? How often do you see them? Do you ever get bleeding in between the periods? Are they heavy? Are they painful? Other questions that we would typically ask?
So we ask about your pain history, how this symptom that you've presented with affects you on a day-to-day basis. We also want to know about your smear history, if you've had any history of infections in the past. We also want to know if you've been pregnant before and what the outcome of those pregnancies were. And we also need to know a bit about your family history. Has anyone in your family got a history of cancer, fibroids, or any ovarian cysts? Remember, your gynecologist is here to help you. Don't hesitate to ask any questions or voice any concerns you may have.
Exactly. And once they've done all the talking, asked you all the questions, the next step typically in the consultation is an examination. So what are the things that we often hear?
So we understand that examinations are probably the reason why most women get really anxious about the whole consultation.
Yeah, for sure.
This bit's really intimidating and people feel like they need to prepare for the examination as well. You may have heard that you might need to wax or shave your pubic hair before you go for the consultation. This is completely unnecessary.
It's also really unnecessary to avoid the appointment if you're on your period. We are so used to seeing blood, it doesn't faze us, and we want to make sure that we get to the bottom of what is causing your symptoms.
It's really important to know that you have control over the entire process. So if you don't feel comfortable, if it's causing you any pain, you can ask the person doing the examination to stop at any point.
So the examination will typically involve a speculum, and that is where most of the discomfort comes from. And it's not unusual to have patients ask if they can do it themselves. Or if you would like that, the doctor can always guide you to make sure it's going into the right place.
The main thing is your comfort and your consent. It's happening to you, so you have control over the whole situation.
So what happens if they've taken the history, they've done the examination, and they still don't know what's wrong with me?
So sometimes when you come in, we don't know what the problem is. So we might have to send you for a few more investigations to work out exactly what's going on with you. This might involve some blood tests, so a scan, and we'll ask you to come back so we can give you the results of your investigations.
And typically, that's what you should expect to happen in a gynaecological consultation. In the UK where we work, in the NHS, it is typically only 20 minutes. And with the long waiting list, we want to make sure that you're making use of all the time effectively.
We hope you found this video useful. Remember to subscribe to our channel for more useful tips about women's health.